Good afternoon, everyone. My name is Aisha Usman, and I am your host for today's webinar. I begin by acknowledging the Wurundjeri people as the traditional custodians of the land on which we stand and pay our respects to their elders past and present. We extend that respect to any Aboriginal and Torres Strait Islander peoples tuning in today. On behalf of the Mental Health Foundation Australia, I would like to welcome and thank each one of you for attending today's Lunch and Learn educational webinar on mental health in multicultural children, presented by Dr. Raj Khillan. Today's webinar will be presented by the Mental Health Foundation Australia in partnership with the Health Awareness Society of Australia and Western Specialist Centre. Before we begin, a disclaimer that this webinar is intended for educational purposes only and should not be relied on as personal advice. Always seek the guidance of your doctor, psychologist, or other qualified health professionals regarding your children's physical and mental health. This webinar will focus on mental health in multicultural children. It will discuss how mental health is viewed differently in every culture. The webinar will focus on the factors affecting children's mental health in CALD communities, the challenges and barriers to access support. I would like to introduce our presenter, Dr. Raj Khillan. Dr. Raj Khillan is the Victorian 2023 Australian of the Year. He is a consultant pediatrician and director of Western Specialist Centre. Dr. Raj Khillan is passionate about working with children with special needs, particularly autism. He is the founding president of the Australian Awareness Society of Australia, Health Awareness Society of Australia, which was established in 2018 to dispel taboos, myths, and misinformation about health. Dr. Khillan delivers information sessions at forums, written and broadcast articles in SBS, ABC Radio, and many newspapers and TV channels. He can speak many languages and provide information in various languages such as English, Hindi, Punjabi, Urdu, and Arabic on topics related to general children's health, mental health, and vaccination. Dr. Khillan is also a board member of multiple non-profit organizations. Please join me in welcoming Dr. Raj Khillan.
Thank you, Aisha. Thank you for having me on board, and it's my pleasure. I think let's go to the topic straight away, mental health in multicultural children. If we talk about the mental health itself is a very complex issue and complex health need, and it depends upon various factors. The factors could be the social factor, religious factor, spirituality, the generational way of looking at the mental health, the cultural experiences, and that's why it become a topic of discussion when we talk about the mental health in multicultural communities, and particularly children of the multicultural communities. Though there may be a second generation children here, second generation migrant, but the mental health is very much governed by the experiences of the first generation of their parents, those who are having their experience from their country of origin. And that's why it's very important for us to understand what underpins the multicultural health, and particularly mental health in children. Next slide, please. In general, knowing what mental health it is and how common it is. So if there are various survey has been done by the Australian Institute of Health and Awareness. If we look at this survey, the psychological distress is such a common thing, and nearly, if we look at the age group of 11 to 15, nearly around 17%, and 16 to 70, which is the highest incidence we see of the psychological stress. So that means high, and this color means is very high. So incidence of psychological stress in children 17 or less than 17 years of age is very common. If we combine all children of both gender, male and female, of all age between 11 to 17 years of age, it has been in this survey shown that 20% of children, they have mental health issues or psychological distress. Next slide, please. What are the common, that is, the first slide was of psychological distress. This is the prevalence of mental health issues. On an average, 14% of the children, they have mental health issues, which is a big number between 4 to 17 years of age. And in fact, it's slightly more common in boys, which is 16% as compared to girls, which is around 15%, on an average around 14%. And these are the four more common illness. One is ADHD, anxiety disorder, depression, and conduct disorder. The four mental health issues are the most commonly seen in children. And that is of irrespective of any culture we are talking about here. It is such a common thing, and the commonness is, of course, is the ADHD, which we know it is more common in boys. And the important thing to look into, the point which I want to highlight is that 30%, nearly 1/3 of the children, they have not only one, they have two or more type of mental health illness. And that is the thing which shows that mental health problem comes as a package. So one invite the another, and the second invite the third one. Next slide, please. Who is at risk of having mental health issues? The children, those who are under protection, or those who are out of home care, living with foster parents or with somebody else, definitely they have 5 times higher odds of having mental health issues. Children, those who are in the youth justice system, children whose parents are mental health illness. So if you have one parent having the mental health illness, then 23% chances that children will have the mental health issues. Or if there's more than two parents, both parents affected, nearly 60% chances having the mental health issues. Then of course, communities, Aboriginal and Torres Islander, they have a high risk of having mental health issues. Children with LGBTQI plus community, then children, those who are refugee and migrant background. And that's where I would be highlighting more, those who are having a more likely to have more issues. And then of course, the children, those who have underlying either physical or intellectual or communication disability, and like children with autism, or the children with the cerebral palsy, or children with another physical illness which limits their ability to socialize with other children, and they are likely to have high chances of having mental health issues. So the point which I want to highlight among the highlight is, which is with the topic today, children with multicultural background, migrant background, refugee background. And there's no doubt likely to have a high chances of mental health issues because of their family, cultural, back home experiences, the whole trauma of migration, and then further degree of hardship what they suffer of adjusting into the new culture, new language, and a new country, a new system. Next, please. Why we are more concerned about the children's mental health? Because we know 50% of the children, those who have mental health issues, they continue to struggle as adult. They're likely to have mental health issues as an adult too. So the origin of mental health issues in adults may be in childhood. It started as a childhood and it continues to be a problem in adult life. Retrospectively, if we see children, those who are seen with the psychiatrist or mental health institute, and if we go back and check the history, nearly 50% of them show the signs that the illness started before the age of 14 in their childhood, but unfortunately remain unrecognized, never been addressed because of various reasons. Studies have also shown the poor mental health of childhood that lead to a long-term struggle for adults, and also a struggle of the healthcare system, because we would be spending billions of dollars of our health system, of our economy, to control the mental health issues in adult age, which could have been prevented in early childhood. There is also a strong link between the adverse childhood experiences, which could be either as a physical abuse or sexual abuse or maybe mental abuse or a post-traumatic stress disorder, and how these acute or adverse childhood experiences leads to the mental health issues. 13% of children experience physical or sexual abuse, and that means nearly 2.5 million children are likely to have a physical and sexual abuse experiences, and they are high likely to have the mental health issues. Fetal alcohol spectrum disorder is another big range of from physical to mental health issues linked with the excessive intake of alcohol during pregnancy. And the incidence expected to be 7.7 per 1,000. That means around 0.7%, which is very, very high incidence. And that's why it said that no level of alcohol is safe during pregnancy. So the importance of understanding the child mental health issues is so important that more than 50% of these children are likely to continue to have issues as adults, and they continue to struggle in the rest of their life, and our healthcare system will keep spending money on that to treat them, and also they will not be able to contribute positively to our society and to our economy. So that's a big financial, social, moral loss of resources if the childhood mental health issues are not tackled at time during the childhood, and it left unnoticed, untreated, and it continues to be in adult age. Next link, please. If we look at the current mental health issue, the current mental health system, how many children are approaching? And that's really, despite the fact we have the evidences that the children mental health issues are so important to be addressed because they're likely to cause the mental health issues in the adult. But still, we don't have any concrete cemented mental health system for children in Australia. So the current Australian mental health system for children is broken. There is no universal way or national way of monitoring or reporting the data of mental health, particularly in children less than 12 years of age. There are few institute which provide services to children more than 12, like Origin, the Headspace, and or the youth mental health places. But unfortunately, in children less than 12, there is no national monitoring or reporting of the system. And then one system which provide the mental health services, it does not collaborate with the other system. So in that way, what is happening, because each of these systems has a different qualifying criteria. So even though the support is available, it is not reaching to the children and family. So that makes the quality of the services also quite variable. Some of the centers are working very very good, providing the excellent services, and another center are not giving the similar quality of services. Then there is a disparity in the services between city, regional, and rural area because of the non-availability of mental health worker over there. So overall access, the survey has shown only 1 in 10 child, that is around nearly, less than one in one child, like 6.9% chances that they will visit to the health professional in the last 12 months in survey it has shown. So it's a significant low number of children are seeing the specialist or mental health professionals for their mental health issues. Next slide, please. So there is a various reason we have very poor or insufficient access to these services. Of course, number of children, particularly after COVID, needing the mental health support, they are much high number as compared to the services available. And at this stage, there's a long waiting list in every mental health institute, whether it's in a public or in private center, including children and adults. As I mentioned previously, the services may not be available to that family. Like particularly, there is no designated services for children less than 12 years of age, though there is an Origin Headspace or youth mental health services are available, which is also in a patchy way. Then they have their own sort of intake criteria. So the services can be refused because they may not meet their severity threshold criteria, or they don't have any confirmed diagnosis. Then lack of awareness among the parents and teachers. Poor mental health literacy is another reason. Due to culturally biased underlying stigmas and taboos attached to the mental health, they are not able to reach to the services, particularly in a public places, and in private, the out-of-pocket cost is too much. Then availability of the specialist workforce to meet the children is also, there is a acute shortage, and shortage is also disparity, as I told earlier, that there is in rural and regional area, we are having an acute shortage of these mental health services, and every family cannot afford maybe 200K or 100K to get access to the mental health services. And that definitely reduce the availability of services, the effectiveness of the services, and the use of these services by the in large, not only by the multicultural community, for the wider community. And multicultural community are affected much more than because of their various reasons, which we'll talk in the next slide. Next slides, please. If we look at the mental health in multicultural community through the cultural lens, and that mental health, in the very beginning introductions, I talked about the mental health, it depends upon various factors. So in each culture, the mental health is viewed or seen differently. In some of the culture, like if you go the Indian subcontinent, South Asian communities, Middle Eastern communities, it is considered as a sign of weakness, or the mental health does not exist at all. So because it is considered as a sign of weakness, the family don't discuss their mental well-being together. Their model is totally different in terms of, because they believe if the mental health issue does not occur, it's a sign of weakness, and I cannot open, particularly being a male, I cannot open my weakness in front of my family. So they don't accept the biomedical model of mental health issues as the Western culture accept. The understanding of child's mental health issues, it also depends upon the family's whole understanding of the mental health issues, the thought and feeling of the family, how the culturally it is being influenced, how family is taking mental health issues culturally. Because if they don't, to the cultural point of view, they don't discuss the mental health, physical signs, the emotional signs or suffering of mental health openly, and it is considered as a stigma or taboos, then definitely child is also not going to discuss mental health openly. It would be also taking all the symptoms back and hiding it. Also taking it because in some of the culture and families, it is believed that mental health is caused by the evil spirits rather than mental health is a biomedical model. So they may be more inclined to talk to the spiritual leader or the community leader rather than talking to the health professional. So this is how, if we look the mental health through the cultural lens, it affects and influences the whole concept of the family towards mental health and mental health services. Then it also depends upon the community we are living in and what degree of community support and the community influence is there. If the community itself believe that mental health is a stigma, is a taboo, is a weakness, then the individual person will be worried about disapproval from the family. They know that they are not likely to get the support from their extended family and community, and they are likely to not to go to the health professional to get the services. So that's why it is important when it comes to the cultural perspective. If we look the mental health of the cultural lens, we need to work collaboratively with the multicultural services, involving the community leader, involving the spiritual leader, and making the part of whole discussion and the services by using either interpreter if there is a need. That would be the best way we can make changes which can be culturally acceptable, and we communicate in a culturally sensitive language, in a culturally sensitive way. Next slide, please. In a multicultural community or culturally and linguistically diverse community, the mental health model, that's what I was talking in detail. This is how the individual child mental health, and that is based by the family and the relationship or intergenerational, generation to generations, how mental health has been taken in this family, and then of course by the community in general, and how the cultural and socioeconomic factor affect. And later on, it comes to the migration, what difficulty child has faced during this migration, what are the economical struggles family or child has gone through, what the degree of struggle, hardship child has faced, any discrimination, racism, and the language difficulty, language barrier child has suffered. It also affects the mental health of children from the multicultural community. Next slide, please. So when the multicultural communities, refugees, migrants come to the community, these are the various factors they go through and which affect their mental health. Difficulty in understanding the Australian cultural system. There is no doubt. I mean, I came here 20 years ago, despite the fact, the English is still there, it was a cultural shock. There is always a risk of discrimination and racism by looking different, having accent different, the way of your body, language is different, your attire is different, your clothes are different, and that can be subjected to discrimination or racism. And children, I know the children in school, sometimes they come because they don't want to take an Indian food because it smells, and they are likely to be bullied in school. So which is a small factor, but taking into consideration how eventually it affects the mental health of the child, it is important to look into that point of view too. And of course, the initial struggle is because of their poor finances, poor English skills too. It may take for them for years to get the English to this level, and so they can communicate and they can be part of the working force or professional force or the business force in the community, so they can effectively communicate, effectively participate in the society. Poor access to transport or cultural support, being separated from their family and friends, which is important thing to take into. They already have a bad experiences back their country. Otherwise, why would they have left their country and leaving their relative and friends and coming to the new place? And that bad experiences from the extended side, and plus leaving their emotional support, their family support back home. So they come here without any support. Some of them are gone through family violence or domestic violence. Then there will be job opportunities for multicultural communities in general, particularly in the public job, is limited because of their language, because of their skills, because of their religious belief. They may go through years and years of further training to get their qualification recognized. And of course, the cultural differences and how they perceive the whole physical and mental health by itself. Next slide, please. As we talked previously, there are various barriers for this multicultural community youth, how to access the mental health services. Because of their cultural experiences in their community, they are scared of disapproval or shame of being disgraced in their family, in their community, in their culture. They're also scared of opening up themselves and opening up their mental health need because of this power imbalance. Because when the multicultural community people are coming, they are trying to establish themselves. They consider themselves weak and feeling dependent on Australians and Australian system. So they are scared of being misunderstood in general, or misunderstood by the cultural practices they are doing. So they are scared it may not be accepted by the Western society. Their coping style to the mental health illness and stresses are different. In various family, particularly as far as my experience is with the Indian subcontinent, they are very resilient in terms of tolerating the mental stress because how it is embedded in the cultural values and identity. And they've been facing the stresses of life from the very beginning, and that makes them more resistant to mental health stresses and become more resilient. And this is the last important factor which I always talk about, religion and spirituality. You cannot separate mental health from religion and spirituality. They always go together. The belief system around your self-care, the belief system around your mental health is important thing, and that always we need to take into consideration. Next slide, please. Again, the same thing as we talked about, they are not accessing the mental health services because of the stigma, taboos attached with that, language barrier, as they cannot open up and cannot explain what they are feeling about. Because the mental health is not considered as as a disease itself, and there is no good mental health services available the country of their origin, and that probably the reason they are feeling the lack of knowledge about, oh, this is there any mental health services available, and then how to access. Even the services are available, unfortunately they are not available in a culturally appropriate or culturally safe way. And because of lack of support, lack of transport, minimum finances, they are not able to access these services. Next slide, please. Next, please. When we talked about the mental health in children and why it is important to address mental health in general in children, and particularly children of multicultural communities. Because we know more than 50% of these children, those who have mental health issues, will continue to struggle as adult. So it is worth spending money on mental health of children so that we can prevent the mental health issues in adult, and they can be effectively part of our society and adding to our society positively, effectively. If we take the mental health as a continuum model, as shown in this arrow, from well to coping to struggling to unwell. So what we see as an adult, we see as unwell, where we are spending more on acute services. We are spending more money on treating the illness because the prevention is over. On the other end, when the continuum is at well stage, that's where the money spent would be more useful, more fruitful. On an average, on a late intervention, every year, government is spending 15.2 billion on late intervention. There is one studies have shown in UK that if we spend equal to around if we spend $1 on prevention program, we will save $2.4. So that is more cost effective to spend money on mental health of children, number one, whether it's treating the acute or late intervention. And then further, more important, to spend money to expand our services for prevention of these mental health issues so that the well-being continuum is maintained on well side. Whenever they reach to the coping stage, give the services, mental health services at that stage, so we are not reaching to the struggling or unwell stage. Next slide, please. And on that model, there are various centers. They are started working on that, but still, as I said, the services are very patchy at this stage. There's still a lot of work need to be done, but we do see there is something is being done. This is from the Center of Multicultural Youth. They acknowledge how important is the multicultural youth to be included in the society, to become part of the society. They know that how culturally mental health is culturally taken into through the cultural lens, how racism, discrimination, and challenges this youth face in navigating their multicultural identity during their establishment, it impacts negatively on their well-being. So money spent initially on the mental health of multicultural youth would be more important. And eventually many lives can be saved and preventing the suicide. Next slide, please. This is same more detail about the Center for Multicultural Youth, how giving brochures, information to all the youth and to other healthcare professionals and mental health workers to reduce racism, reduce discrimination, understanding of the culture, understanding of the language and the cultural experiences and expectations, so that cultural diversity can be flourished. Next slide, please. This is the same continuation of the same. Next slide, please. Another association, Mental Health in Multicultural Australia, they have also made the framework of on the similar line. That's the 5 concepts. They are taking the key concept. Of course, concept of cultural responsiveness, looking into the risk and protective factor, providing them culturally responsive practices, involving them into the decision making, and promoting more cultural diversity. Next slide, please. This is an Australian early childhood mental health initiative, which is working on the same line, how to create a sense of community and promoting the cultural diversity. So what I mean to say, all these patchy places, these services have been started by the Center of Multicultural Youth or Kids Matter or Early Childhood Mental Health Initiative, but these are all patchy. But the important thing to understand is the understanding of culture, importance of cultural diversity, and how to make best use the available services and promote the mental well-being in migrant community, multicultural community from the early stage, from the childhood. Next slide, please. Yeah, next please. This is again Center for Multicultural Youth, the multicultural youth people and their mental health, giving informations to multicultural community, healthcare worker, mental health care worker. Next paragraph, please. Next slide, please. So this is, I just wanted to mention that the Australia is the first multicultural mental health line launched in New South Wales in 5th of January 2023. It's a very big initiative, and where they provide the mental health support to multicultural community in nearly 30 different languages. Because I believe the language is a window of any culture. If we know the language, if the support is provided in their own language, that would be most effective. It would be taken seriously, and it would be passed on to next generations too. Through interpreter, we miss many body language, gestures, and the meaning of various words can be twisted. So giving the mental health services in their own language by the professionals, those who are trained from the multicultural community, those who understand their culture, those who understand the language, they understand the cultural diversity and how the religion and spirituality is affecting their community mental health. That would be the way to go. Thank you very much.